Scenario, mother has run up to me screaming that something is wrong with her baby. So first things first, I'm going to check the scene, make sure everything's safe. Once I see that everything is safe, I'm then going to ask the mother for consent to be able to help her child. Once the mother does give consent, I'm going to check for responsiveness of the infant. So in order to do that, you flick the bottom of the foot or tickle it a little bit to see if you get a response. Now that this baby in particular has not given me a response, as I did not see the baby collapse, I'm going to ask the mother to call 911 while I begin care. The first thing I have to do in order to give care is check the ABCs, airway, breathing, circulation, and severe bleeding. So as I check the airway of the baby, I see that it's clear. There is no breathing, at least not that I can see. I'm going to get down towards the baby's face, and this should take 5 to 10 seconds. I'm going to listen for air coming out of the windpipe. I'm going to watch, see if the chest rises and falls, and I'm going to slightly feel, in case my eyes miss it, I can feel the chest rise and fall or feel the breathing happening. So now that I've seen there's nothing blocking the airway, no breathing, there's no pulse, so that's circulation, no checking pulse, and I don't see any severe bleeding anywhere, I would start then CPR, beginning with 2 rescue breaths. So I'll take my breathing barrier and I'll give a breath for 1 second. It should last 1 second or until the chest rises and falls. Give another one, and then I start with 30 chest compressions. And in order to do that for an infant, you use 2 fingers right in the middle of the sternum, and you go down at most 1.5 inches. So in order to do that, I'll start like this. And then I give 2 more rescue breaths. And now that I've done 2 sets of chest compressions, in a real life scenario, you would do normally 5. If you have somebody there who is also CPR certified, at that point you would then switch to prevent fatigue and exhaustion. There's 5 scenarios in which CPR can be stopped or halted, I guess. If the victim becomes conscious, if there's an AED present, a higher trained medical professional shows up, you're too exhausted to continue, or the scene becomes unsafe.